Hey, is that really the head of a pin in the lower right? What's that stuff growing on there? That's bacteria? Gross. Bacteria are prokaryotes, which means they have no nucleus. So they're not viruses, and they're not animal cells. They're bacteria, composed of two different groups. The archae, think of archaeology, ancient. These are the ancient bacteria that oxidize sulfur and other chemicals for energy. But the more modern bacteria, the ones most people are interested in, are the eubacteria. And they're widespread, found nearly everywhere today. Features of bacteria. Oh, there's so many. Let's start with the peptidoglycan polysaccharide cell wall. My gosh, that's a mouthful, but let's look at it. Polysaccharide means many sugars. So that's just what the peptidoglycan is made of, is many sugars. Now, they may have a very thick gram-positive cell wall made of many layers of peptidoglycan, and that's going to stain purple when we use crystal violet. And you might say, well, who cares if it stains purple? Well, I'll tell you shortly why that's important. If you've ever admired someone's shape or their anatomy, then you understand this concept. Bacteria has anatomy. They can be round, which is called coccus. If there's two of these together, we call it diplococcus. The gonorrhea has that kind of shape. Or it can be a clump of coccus, which we call staphylococcus, or just staph for short. We find those in skin infections. We're coated in staphylococcus, even right now. Right after a shower, you still have staphylococcus all over you, and that's good. We want it. Streptococcus, or just called strep, is a chain of coccus, and strep throat typically is caused by a type of strep. Bacillus is a rod-shaped bacteria. An example is anthrax, a very deadly type of bacillus. Spirillum or spirochete is a spiral-shaped. It's, well, syphilis is one, but there's many, many types of spirillum-shaped bacteria out there. Colony morphology, this means the appearance of a bacterial colony. Bacteria are tiny. We can't see them until they reproduce into millions, all growing together in a clump, and then suddenly there they are, that big disgusting mess we call a bacterial colony. And each type of bacteria produces a very distinctive colony, and that helps us to identify them. Ooh, man, that's really gross. I mentioned the gram stain earlier. It refers to how thick the cell wall is. So if we're treating a patient, we'll take some body fluids, such as blood or urine, streak them on a plate, grow them into colonies, and now we have lots to work with. We'll stain some of the bacteria with crystal violet, determine if it has a thick cell wall, which is gram-positive, or a thin gram-negative sort of wall. And that helps us treat that patient. For example, if we're going to use an antibiotic to treat a patient, these are substances that kill bacteria. But we have to try to focus on the right drug for the right bacteria. We'll do a plate like you see here. We've streaked it with staphylococcus, and then we put antibiotic disc down there, and the one with the biggest halo is going to be our best drug, as long as there's no allergic reaction. So if someone has a gram-positive bacterial infection, we're going to try to use something like penicillin to kill it. But if they have a gram-negative bacteria, we're not going to give them penicillin. We're going to give them something in the erythromycin group, and that's going to do the job. I don't like capsules, and I'll tell you why. Let's first discuss what they are. They're a layer of polysaccharides that form a gelatinous surface, so it's going to be really slippery. And what it does is it enables bacteria to escape our macrophages. It's like squeezing a wet watermelon seed between your fingers. It's going to pop right out of there. And that's exactly what happens when a macrophage tries to consume a encapsulated bacteria. For example, Streptococcus pyogenes. We're all familiar with this one. It causes that scratchy throat when we haven't been taking care of ourselves. Maybe we haven't eaten right, we missed some sleep, we're depressed, whatever it is. That gives Streptococcus pyogenes permission to divide, penetrate into our body tissues. Where it has that capsule, it's going to slip away from our macrophages, and we're going to get sick. A glycocalyx is a loose, fibrous capsule. We call it the slime layer. It attaches to smooth surfaces. A good example is Streptococcus mutans. Every night, it loves to feed in our mouths as it attaches to our teeth. What it does is it's going to consume anything in our mouth that's carbohydrate based, and it's going to urinate its waste products, and that's the substance that's going to erode our enamel, and that's why we wake up with that terrible breath in the morning, and that's why we want to brush our teeth really thoroughly before we go to bed. They also use a calcium from our saliva to protect themselves of this hardened plaque. Strep will gradually erode tooth enamel with these acidic waste products until the periodontal region, peri means around, the region around the tooth is invaded and the gums swell and bleed, and we now have periodontal disease. But if this is untreated, then the alveolar bone around the tooth may dissolve, the teeth fall out, and it may not hit us till our 50s or 60s, but there we find ourselves toothless. What's the oldest living thing on Earth? It might be a bacterial endospore living in the gut of an old Egyptian mummy. The thick peptoglycan endospore of some of these bacteria is so resistant, they can withstand drying, boiling, freezing, they laugh at alcohol, and even radiation can't kill them sometimes. But you know what? You can kill them when they are in their active stage, because it's no fun being in an endospore. You can't reproduce. So they're going to leave the endospore stage when conditions look pretty good, and they'll enter a vegetative state when they can reproduce. This is why we must take antibiotics for several days, because that medicine is not going to kill them in their endospore stage. So let's say they're in the endospore stage for 3 days, and then the bacteria suddenly says, hey, time to become vegetative and have some fun, we're going to start reproducing. Hopefully you're going to take your medicine on day 4 and day 5 and kill them all. Because if you don't, if you want to save that medicine, then you may get sick again. And then that complicates the whole story, because that medicine may not work on the second round of that endospore. Toxins, there's many types. I'll start with exotoxins. These are produced by bacteria that they're going to release proteins towards specific targets, such as organs of the body. One of the examples is Clostridium botulinum. It produces a powerful toxin, so toxic that 1 pint of this could kill every person on planet Earth. I wouldn't test you on that, but that's pretty impressive, huh? Clostridium botulinum works by inhibiting the release of acetylcholine. And this is a chemical that's in the synapse, the junctions between our nerves. If we have something extreme, then it's called flaccid paralysis. And we're going to relax to death because all of our synapses are tied up with this Clostridium. But we can use local injections of Botox, which just causes localized relaxation of muscles, and it's fairly safe. Clostridium tetani works in sort of an opposite way, because it's going to inhibit the removal of acetylcholine at those synapses. Both of these are types of neurotoxin exotoxins because they're going to target the synapses of the nervous system. More about C. tetani here. The exotoxins are going to cause the motor neurons to stay locked in position. We get a tetanus, it's called, full muscular contraction. The symptoms may be localized. It starts off as something lockjaw, but in advanced infections, we may have full body deadly contractions, such as we see in this famous painting of one of Napoleon's soldiers dying of this terrible disease. the muscles are in full contraction. The lower back muscles are stronger than the abdominal, so the arching, classic arching of a tetanus infection. Clostridium difficile, known also as C. diff, and hospitals know about this one. Antibiotics can cause an inflammatory response, and so people in sometimes the intensive care units break out, and we have to mask up, glove up, put on aprons, get a HEPA filter going, because nobody wants this one. The protein enzymes released by C. diff are going to cause diarrhea and production of certain type of white blood cells that are diagnostic for this disease. The diarrhea is impressive. Endotoxins, let's keep our notes straight. I just finished talking about exotoxins. So here are endo. And these are a little different. If you look at the diagram, what happens here is when the bacteria dies and the cell wall falls apart, those pieces of the cell wall are the toxin. And think about this. If you have someone who's really sick with lots of bacteria, you give them a high dose of antibiotics, it's going to kill millions of bacteria. And if it's an endotoxin bacteria, suddenly their bloodstream is flooded with endotoxins and they go into shock and die. So we have to be careful when we're treating patients. Endotoxins can hinder blood clot formations and cause hemorrhaging, which is extensive loss of blood. Flagella. Flagella means whip in Latin. And these are long, rigid protein strands that are bent, at least at the molecular level, into a helix. Cholera is a bacteria that swims through mucus in the intestines, and here they form colonies. Cholera is famous because it causes intensive diarrhea, and so the patients lose large amounts of water. Many deaths each year caused by cholera, mostly in the poor areas of the world. Generation time. This is the interval of time between each bacterial cell division. One of the all-time champs, Escherichia coli, we often just call E. coli, 20 minutes between each cell division. So you might start the day with one E. coli. Let's say you touch your sandwich with your finger, and then you leave that sandwich sitting all day long. Oh, I forgot to take it to work. I'll just eat it tonight. Okay. By the nighttime, that one bacteria has become over 1 billion. So they contaminate food very quickly, and we suddenly reach dangerously high populations of E. coli. Watch out for this one. And that reminds me, that's why at the dinner table, I don't let people use their fingers. I'm very clear about that. Okay, pili. These are appendages that help to anchor bacteria and transfer their genetic material from one to another. So it's like a long-range mating. Well, the pili is hollow. There are many strains of gonorrhea that cause a sexually transmitted disease, and they're drug resistant. So researchers have had to switch their strategies and try to control gonorrhea by using an anti-pili antibody, so that the gonorrhea can't use their pili. Pretty clever. Review here. Bacteria prokaryotes. There's two groups. The archae. Think of archaeologists, right? Ancient. And the eubacteria, the modern ones. Cell wall, peptidoglycan. We can't forget that. Anatomy means shape. There are different types of coccus. There's Diplococcus, staph, and strep. Staph is a clump, and strep's a chain. Bacillus is rod. Think of anthrax. Spirillum is that spiral shape, such as syphilis. Morphology refers to appearance, such as a colony. And when we have someone with an infection, we're going to take some body fluids, grow them in a colony, and then gram stain them. If it has a thick peptidal wall, then we're going to use something like penicillin. If it's a thin wall, we use a different type of antibiotic, such as erythromycin. Capsule is that slippery polysaccharide. that escapes our macrophages, and Streptococcus pyogenes, a very famous encapsulated bacteria that causes that upper respiratory tract infection and may kill us if we're not careful. Glycocalyx is a slime layer that enables Streptococcus mutans to attach to the slick surfaces of our teeth. They also form a plaque out of calcium. Over time, we get periodontal disease and our teeth fall out one by one. Endospores are very resistant. It's a thick peptidoglycan, which is going to survive unless we take the full course of antibiotics. Take every last one in that bottle, kill it dead. Exotoxins, these are released to affect target tissues, such as organs. Botulinum is the one that interferes with acetylcholine, and we get flaccid paralysis. Tetanite works the opposite way, affecting acetylcholine and motor neurons. And finally, C. difficile causes that enterotoxin diarrhea. An endotoxin is different because, in this case, the cell wall breaks apart. It may cause interfere with clot forming and may cause hemorrhaging. Flagella is the whip. It's found in cholera. It's a protein used for swimming, such as in the mucus lining of the GI tract. Cholera causes extensive diarrhea and death in many cases. Generation time is just how fast you can reproduce, and the champ there, E. coli at 20 minutes. Between cell divisions and 1 billion in a day. Finally, the villi are very strange. They're appendages, but they're also hollow, and they can transfer their genes from one to another. And we're using this concept to treat patients with gonorrhea. Man, these guys are really something, these bacteria.